Hi guys, Jenna Ellis here, physical therapist for Primal 7. Today we're going over some hip questions that we got from you guys off Facebook and Instagram. So we'll start with this question here. This one is from our Facebook group and it said, I have persistent pain in the left hip, coming in straight from the outer hip into the hip joint. Crazy tight IT bands on both legs and less mobility on the left side than the right. I also have pain and tingling in the left foot. Hi, thank you for your question. It sounds like you possibly might have some lower back nerve issues, an issue at your lower back coming from the spine. So you probably first should check with your MD or your physical therapist so they can get a good look at you before you start any exercise program, really. It's really hard to diagnose and help somebody out over the internet without seeing them face to face and actually being able to assess how the joints move, how the muscles are working, so on and so forth. So the very first thing to do would actually be to see your doctor or your physical therapist about it. Little things though that I would suggest if I came across something like this in the clinic, I would first look at mobility, making sure our legs are nice and stretched out. I would start with foam rolling of the IT band. Make sure that when you're foam rolling, you're not rolling over the little bone that juts out on the outside of your hip. There is a bursa that sits on top of it, and we don't want to roll over top of him and make him mad. So I always go below that little bone jutting up from the side to the outside of the top of my knee, just back and forth, nice and easy. You can also use a stick. There's little like rolling sticks like massaging sticks that you can do. And also, if you don't have one of those, you can use your rolling pin. Really easy to do. Just sit in a chair, kind of relax your leg down, and then just roll on the outsides of your quadriceps and your IT bands. That'll help you get a little bit less tight in those ITs. Other things to be aware of definitely is posture. Make sure that throughout the day you're keeping your abs in nice and tight, and also make sure that you have good lifting techniques. We'll actually have a blog post coming out soon with the release of our lower back series, and that actually has a lot of tips on how to properly lift and move throughout the day, especially when you're going to lift a child from the floor or a box. It can even be as simple as picking up a pencil or a sock from the floor. We want to make sure that we have really good lifting techniques so that we're not flexing too much the spine or awkwardly bending in our knees or anything like that. So please be aware of your posture. Always keep your abs in nice and tight before you go to lift something. Other things that I would start with would be stretching out the quads and the hamstrings, making sure you're nice and mobile there. It's going to be a little bit of a journey, especially if you've got stuff from your lower back happening. So again, we would start with some core stability, just basic exercises, and then light stretches. Make sure you're doing these consistently on a daily or every other day basis to be able to get the best results. You can do this. If you stay consistent, you should start to see some results coming up in the next few weeks.